We are just about a month away from the city's original timeline to break from the public health district and form its own city health department. But the Nueces County judge worries that there might be a bigger impact, including an interruption in services to lower income families.
Yeah, and tonight Michael Gibson has more on the issue as others involved in this breakup try to reassure that no one's health is going to be jeopardized by the split.
County Judge Barbara CANALES believes the city's January the 18th deadline to split from the public health district needs to be extended by 6 months. That way, it would give everyone time to ensure that health care services wouldn't be interrupted for those that depend on the health district for their care.
What's right for NUECES after COVID is that we make certain that those that are most vulnerable among us get access to health care. And I don't believe that a department that hasn't been formed and that only has a flyer to boast of, that's all they've got, they've presented us a flyer, is appropriate to say, I'm going to just hand it over.
Commissioner Brent Chesney says the most vulnerable who rely on the health district's health care services won't have anything to worry about during this change.
There is no change. There's not going to be a change. Whoever runs this, however it goes, citizens are going to be well served. We're not going to waste taxpayer dollars.
We spoke with City Councilman ROLAND about the concerns, and he also wanted to assure those residents who live outside of the city that they will be continuing to receive the same level of health care.
We want to be able to ensure that those individuals in those outlying areas are going to have access to care.
CANALES believes the county can go on its own, but she still wants that extra 6 months' time to line everything up.
And I believe that we, the county, can have our own health department, and we can deliver great health care to our rural communities.
Commissioner Chesney is worried about where a county health department would be located and how much it would cost.
We don't have a lot of infrastructure at the county. The city has most of the infrastructure. They have most of the buildings. They have most of the infrastructure involved. So we would have to recreate and spend a lot of money to do our own health district. That's hard for me to get my arms around because 90% of the county are residents of Corpus Christi.
Both Commissioner Chesney and City Councilman BARRERA maintain that however this all shakes out, the health care for the 10% of those residents won't end simply because the county and city are going through a divorce. Michael Gibson, 3 News.